2, 1.
Hello there, my name is Farrell David, and this skill segment involves swabbing for the nasal swab for the flu, the nasopharyngeal swab for COVID, and also a throat swab for strep. So my patient's in a supine position, head a bit up. I will have explained to him already the doctor's orders and why we're doing these tests. My hands have been washed and my gloves have been applied. So the first thing I'm going to do is I'm going to work with the flu. So for the flu, I'm going to use the red top. This one has a breakaway swab, so we're going to go ahead and tell him what's going on with this. I'm going to get my stuff out. When I remove the cap, I'm going to make sure that I set the cap upside down on a steady surface. I'm going to ask him to tilt his head back some. I'm going to make sure that he doesn't have any nasal trauma or anything that's going to contraindicate me sticking this at least 1 to 1.5 inches in. Here you can see there's a guide, there's a ridge on here. So what I'm going to ask him to do is just to lay back, relax. I'm going to stick this in this far, pinch the nose, and I'm going to swab for about 10 seconds, 10-15 seconds. Come in the other side, an inch, and swab. Once I have take it out, I'll go ahead and place it in the medium. There's a little red line on the end where I'm going to crack the stick. Get rid of it. Grab the cap. Aseptic technique is important, so we're going to place it right on the top, precisely in its place. Once we have it here, I'm going to tell the patient that I'm going to label this with his ID, patient ID label, to avoid confusion and testing on the wrong patient. Now, what I'm going to do with him next is I'm going to go ahead and swab his throat just to make sure, just to have a test for the strep infection. Okay, we're going to remove the purple top. Here you can see purple top is what we use for strep A and B. So what I want to do first is I want to ask him to open his mouth and say maybe have a tongue depressor with me so I can press his tongue down and see the actual spots that I want to go ahead and swab. Once I do that, I'm ready to start. I'm going to remove the top, set it down on a firm surface. I'm going to go gently in the back and have him say I'm going to find that little pus pocket in the back of his throat, and I'm going to swab it, trying to get some cells come out. Make sure that I don't brush up against any of the other landmarks in the mouth, like the uvula, the tongue, or the cheeks, or the teeth. Break the stick off, again, just like I did with the flu. Put the cap back on precisely, and again, label this with the patient's name and identification numbers. The last one is probably going to be the most uncomfortable. This is for the nasopharyngeal swabs. They've been going in a way in the back of the nose for the COVID vaccine lately. So we're going to use the orange top for that. It's a flex shaft here. It's bendable. The thing I want to do with this is I want to let the patient know that I'm going to go way in the back, and it's going to be a little uncomfortable, but it's just for a moment. I want to make sure that he doesn't have any polyps or deviated septum or any kind of nasal problems that are going to harm me or make it too difficult to swab. So once we do that, I'll check his nares out. I'm going to go ahead and stick this in perpendicular, and as long as I don't meet any restrictions or any blockage, obstructions, I'm going to go ahead and twist it, pull it out, go in here again, and I'm going to, you see how far it goes. It's in the back of his nose, nasopharyngeal area. Come out, precisely put it in the tube, cover it, label it with the patient's name on it. All three need to go to the lab within 20 minutes. The results are going to come back to him from the doctor in about an hour.